According to the Agency for Healthcare Research and Quality 2016, adverse drug events are the most common post-discharge complication. Currently, the Centers for Medicare and Medicaid Services utilizes the HCAP surveys, which are also known as the Hospital Consumer Assessment of Healthcare Providers and System Surveys. They use these surveys as one way to measure the quality of care hospitals are providing and determine reimbursement. This is also known as pay for performance. According to Ahrens and Wurges 2013, page 281, paying for performance incentive programs are being used as a strategy to promote improvements in the delivery of quality health care, and patient satisfaction is becoming of ever-increasing importance. Currently, Mercy Hospital in Buffalo, New York scored a 55% patient satisfaction rating on the HCAP survey for medication communication, specifically medication side effect communication. The New York State average was 60% and the national average was 65%. So we can see that we score well below state and national average on this forum. Based on the above data, the basis for the project was found. It was necessary to implement a best practice to improve medication communication between nurse and patient in order to improve patient safety and provide for better health outcomes. In forming a team, I considered the people who would positively influence the project and who also had experience. I chose my nurse manager in the unit that I work in. We have 2 charge nurses that serve as charge nurse when the other is off. They have a lot of influence over the staff, and they are both very knowledgeable with a lot of experience. So I decided to help them, incorporate them to help me in the project. I chose clinical pharmacists in the hospital because this is a medication-related improvement project, and also another staff RN that I knew would help support me in the improvement project. The specific aim of the project was to increase patient understanding of medications and their side effects by implementing a medication education program. The change concept that was used was a literature review to first see why there was ineffective communication between nurse and patient about medication side effects. The literature was reviewed, and lack of verbal counseling and patient understanding was what led to the most ineffective communication. From this evidence, through collaboration with team members, the thought was to develop an improvement process that would be mutually supportive of the verbal written education process for patients. Recent relevant research studies demonstrated a significant improvement in patient satisfaction with the intervention of a medication side effect information sheet. So we chose as a team to develop this. I developed it specifically and had approval of the team members. We tailored it to commonly prescribed cardiac medications for the unit population. After the medication side effect information sheet was developed, a laminated copy was placed on all the bedside computers that the nurses would use to administer patients their medication. And also they could use this during verbal counseling. And then the copies were made to give as an education handout for the patients when they were also given their discharge medication reconciliation. The nurses were instructed and educated about the basis for the project, what the interventions would be for the improvement project. They were also reminded that it was hospital policy to explain side effective medications to their patients. Following the PDSA cycle, the plan part of the cycle was to search literature for evidence-based interventions, and with input from team members, a specific medication side effect information sheet was developed. All nursing staff on the unit was educated on the basis and interventions for the improvement project. The do part of the project was the implementation. The medication side effect information sheet was utilized by nursing staff during verbal counseling and also given to patients with a printed copy of their discharge medications completed by the provider. Patients were asked to complete a 3-question satisfaction survey after discharge teaching was complete. The study part of the project was to analyze the results of the independent patient satisfaction survey and compare these results with the HCAP scores. The ACT part was once the results of the data analysis showed patients were satisfied with the use of the medication side effect information sheet they had received, along with the verbal counseling from the nurse, to continue to utilize this to promote the verbal written communication process. Implementing and spreading the change. Consistent education for the nursing staff, as well as observing for adherence to the interventions, was done, and re-education completed when necessary. Barriers were nursing staff not adhering to the verbal counseling sessions with the patients, rather just giving the patients the medication side effect information sheet with their discharge medications for an independent review at home. Also, nursing staff was not compliant with having the patients fill out the independent satisfaction surveys. Once the barriers were recognized, I did a review, looked for why these barriers were taking place, and ultimately time constraints and skepticism were identified as the most prominent barriers impeding the project. This was reviewed with the team members. I did a literature review, searched for the barriers, and the 3 most prominent barriers that were in the research studies through the literature review were time constraints, skepticism, and polypharmacy issues, where the patients had so many medications that the nurse felt she didn't have the time to go over all the side effects for all the medications that the patients were on. The project was modified, the barriers were addressed, and changes to continue to spread the success were implemented. This consisted of re-education of the nursing staff on how medication side effect education contributes to patient safety, stressing that verbal counseling and the medication side effect education handout are mutually supportive of each other, and also when they did their side effect teaching for the polypharmacy patients to focus only on the cardiac medications if they felt that their time was limited with the patient. After a 4-week period of collecting data using the medication side effect information sheet through verbal counseling at the bedside with the patient and also giving it as an education handout, there were 112 satisfaction surveys completed by patients and returned to me. I did a data analysis. The current HCAP scores were 55% for the Mercy Hospital Buffalo for medication communication. My independent patient satisfaction survey showed a satisfaction rating of 90.5%. This was an overall increase of 35.5% after initiation of the improvement project, with patients' satisfaction on their medication communication. In summary, the impact on practice was that the data revealed a significant increase in patient satisfaction with nursing communication about prescribed medication side effects with the use of the medication side effect information sheet. The improvement project will contribute to increased patient safety, likely less hospital readmissions related to adverse drug events because patients understand what the side effects will be, should be, and should not be, and will alert their provider if they experience these. And in turn, ultimately, this will lead to better patient outcomes.